Constipation. Definition. Constipation occurs when a person has difficulty emptying the large bowel. Constipation is generally described as having fewer than 3 bowel movements a week. Constipation occurs when bowel movements become less frequent, less than 3 week, and stools become difficult to pass, hard-dried. Risk factors. Factors that may increase risk of chronic constipation include being an older adult, being a woman, being dehydrated, eating a diet that's low in fiber, getting little or no physical activity, taking certain medications, including sedatives, opioid pain medications, some antidepressants or medications to lower blood pressure, having a mental health condition such as depression or an eating disorder. Causes. Constipation most commonly occurs when waste or stool moves too slowly through the digestive tract or cannot be eliminated effectively from the rectum, which may cause the stool to become hard and dry. Chronic constipation has many possible causes. Blockages in the colon or rectum. Blockages in the colon or rectum may slow or stop stool movement. Causes include tiny tears in the skin around the anus, anal fissure, a blockage in the intestines, bowel obstruction, colon cancer, narrowing of the colon, bowel stricture, other abdominal cancer that presses on the colon, rectal cancer, rectum bulge through the back wall of the vagina, rectocele, problems with the nerves around the colon and rectum. Neurological problems can affect the nerves that cause muscles in the colon and rectum to contract and move stool through the intestines. Causes include damage to the nerves that control bodily functions, autonomic neuropathy, multiple sclerosis, Parkinson's disease, spinal cord injury, stroke, difficulty with the muscles involved in elimination. Problems with the pelvic muscles involved in having a bowel movement may cause chronic constipation. These problems may include the inability to relax the pelvic muscles to allow for a bowel movement, anismus, pelvic muscles that don't coordinate relaxation and contraction correctly, dyssynergia, weakened pelvic muscles. Conditions that affect hormones in the body. Hormones help balance fluids in body. Diseases and conditions that upset the balance of hormones may lead to constipation, including diabetes, overactive parathyroid gland, hyperparathyroidism, pregnancy, underactive thyroid, hypothyroidism. Symptoms. The main symptoms of constipation are difficulty passing stool, straining when passing stool, passing less stool than usual, lumpy, dry, or hard stool. Other symptoms include pain and cramping in the abdomen, feeling bloated, nausea, a loss of appetite. Diagnostic evaluation. History taking. Taking history regarding the constipation, diet, medication may help evaluate the health status. Physical examination. A physical examination may include a rectal exam, abdominal palpation, bloating. Lab tests. Blood and urine tests reveal signs of hypothyroidism, anemia, and diabetes. A stool sample checks for signs of infection, inflammation, and cancer. Imaging tests. Computed tomography, CT, magnetic resonance imaging, MRI, or lower gastrointestinal tract series may be ordered to identify other problems that could be causing constipation. Anorectal manometry. An anorectal manometry is a test used to evaluate anal sphincter muscle function. For this test, the doctor will insert a thin tube with a balloon tip into the anus. When the tube is inside, the doctor will inflate the balloon and slowly pull it out. This test allows them to measure the anal sphincter's muscle strength and see if muscles are contracting properly. Barium enema X-ray. A barium enema X-ray is a type of test used to examine the colon. For this test, patient will drink a special liquid the night before the test to clean out the bowel. The actual test involves the insertion of a dye called barium into rectum, using a lubricated tube. The barium highlights the rectum and colon area, allowing the doctor to better view them on an X-ray. Colonoscopy. A colonoscopy is another type of test doctors use to examine the colon. In this test, doctor will examine the colon using a tube that's outfitted with a camera and light source. Colonoscope. Marker study. A marker study, also called a colorectal transit study, is used to test how food is moving through colon. For this test, patient will swallow a pill that contains tiny markers that will show up on an X-ray. Numerous abdominal X-rays will be taken over the next few days so the doctor can visualize how the food is moving through the colon and how well intestinal muscles are working. Management. Laxatives, stool softener. Some laxatives are available over the counter, while others are available with a prescription. People should only consider using laxatives if making lifestyle changes has not helped. It is best to check with a doctor before use. The following are some laxatives and stool softeners that may help ease constipation. Fiber supplements, also known as bulk-forming laxatives, these may be the safest option. Fibercorn is one example. People should take these with plenty of water. Stimulants, these cause the muscles in the intestines to contract rhythmically. Senocote is one example. Lubricants, these help the stool move smoothly through the colon. One example is mineral oil, Fleet. Stool softeners, these moisten the stool. Examples include Colas and Suffolk. Osmotics, these draw water into the colon to hydrate the stool and ease movement. Saline laxatives are a type of osmotic. Neuromuscular agents, these include opioid antagonists and 5-HT4 agonists. They work at specific receptors to regulate movement through the gut. Natural remedies. Increasing fiber intake. Adults should eat 25-31 grams of fiber every day. Fresh fruits and vegetables, as well as fortified cereals, have a high fiber content. Adding fiber-containing bulking agents to meals can help soften stools and make them easier to pass. One option is to sprinkle a tablespoon of wheat bran onto breakfast cereals or add it to a yogurt or smoothie. Drinking water. Water can help rehydrate the body and prevent constipation. Getting regular exercise. This can help make bodily processes more regular, including the passing of stools. Establishing a routine. Have a usual place and time of day to visit the bathroom without forcing a stool. Avoiding holding in stools. Responding to the body's urges to pass stools can help prevent constipation. Elevating the feet. Some people find it easier to pass stools during a bowel movement if they place their feet on a low platform, such as a step, with their knees above hip level. Complementary and alternative remedies. Other possible therapies include acupuncture, massage, herbal remedies, and moxibustion, which involves stimulating acupuncture points with the herb mugwort. That being said, the use of herbal remedies is complex, and people should always speak to a doctor before trying anything new, as they can have adverse effects. Surgery. If laxatives do not work, a doctor may need to remove impacted stool manually or surgically. If constipation does not respond to treatment or if there are other symptoms, a doctor may suggest an abdominal imaging study, such as a CT scan, MRI scan, or X-ray, to see if there is a blockage due to an underlying disease process in the gut. Nursing management. Nursing diagnosis. Constipation related to pain on defecation secondary to hemorrhoids as evidenced by the patient reporting not having a bowel movement for 5 days, hard stool, rectum pressure, and painful hemorrhoids. Nursing interventions. 1. Educate the patient on the importance of having normal elimination process by having good nutrition and correct amount of liquid intake. Rationale. It will prevent occurrence of such problems on elimination such as constipation. 2. Advise the patient to have an oral fluid intake of 2000 to 3000 ml day, if not contraindicated. Rationale. It will prevent the occurrence of constipation if there is enough fluid intake because it will soften the stool. 3. Advise patient to increase intake of dietary fiber. Rationale. It will make elimination easier because it adds bulk to the stool. 4. Let the patient undergo such activities or exercises per day. It promotes better blood circulation going to the different parts of the body including the digestive system. 5. Encourage the patient to have a regular period for defecation. Rationale: it will let the patient have a regular schedule in defecation. 6. Determine presence of hardened stools which will not let the patient defecate easily. Determine measures of removing the stools if needed. Rationale: it will let the patient become comfortable by helping him/her in removing the impacted stools. 7. Promote privacy of patients during defecation. Rationale: it will help promote defecation. 8. Administer medications such as stool softeners and suppositories as prescribed. Rationale: it will promote easy defecation of patients who are constipated for several days. Prevention: changing diet and increasing physical activity level are the easiest and fastest ways to treat and prevent constipation. Try the following techniques as well. Every day, drink 1.5 to 2 quarts of unsweetened, decaffeinated fluids, like water, to hydrate the body. Limit consumption of alcohol and caffeinated drinks, which cause dehydration. Add fiber-rich foods to diet, such as raw fruits and vegetables, whole grains, beans, prunes, or bran cereal. Daily intake of fiber should be between 20 and 35 grams. Cut down on low-fiber foods, such as meat, milk, cheese, and processed foods. Aim for about 150 minutes of moderate exercise every week, with the goal of 30 minutes per day at least 5 times per week. Try walking, swimming, or biking. If urge is felt to have a bowel movement, don't delay it. Delaying makes stool harder. Add fiber supplements to diet if needed. Just remember to drink plenty of fluids because fluids help fiber work more efficiently. Use laxatives sparingly. Never use laxatives for more than 2 weeks without talking to doctor. The body can become dependent on them for proper colon function. Consider adding probiotics to diet, like those found in yogurt and kefir with live active cultures. Sources have shown that this dietary change can be helpful for those with chronic constipation. Complications: swollen veins in anus, hemorrhoids, piles. Straining to have a bowel movement may cause swelling in the veins in and around anus. Torn skin in anus, anal fissure. A large or hard stool can cause tiny tears in the anus. Stool that can't be expelled, fecal impaction. Chronic constipation may cause an accumulation of hardened stool that gets stuck in intestines. Intestine that protrudes from the anus, rectal prolapse. Straining to have a bowel movement can cause a small amount of the rectum to stretch and protrude from the anus.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.